We present a case of an endothelioplastic lens implant, Endoart, in a patient who had multiple failed keratoplasties and had limited visual potential. We are performing a paracentesis with a 1.2 mm blade and a main incision with a 2.2 mm blade, slightly enlarging it to facilitate the entry of the plastic lens. Here we see how the lens comes, which we pick up with a blunt forceps, trying not to fold it in order to maintain the correct orientation. We carefully place it directly onto the delicate corneal epithelium, and on the left side, we can clearly see an F that is already precisely printed on the transparent plastic material, which unequivocally indicates the correct and proper orientation of this specialized lens. We observe how we place a safety suture, since the patient has a large pupil, to prevent it from passing into the posterior chamber. This suture is made of 10-0 proline. And once we have secured the lens with this safety suture, we use a spatula to slide it toward the scleral area, applying pressure through the incision we made. With some difficulty, since this is a hypotonic eye that had also undergone vitrectomy, we managed to insert the lens into the anterior chamber. Next, we place an air bubble, making sure we are behind the plastic lens, since it is difficult to visualize, and using intraoperative OCT, we confirm that the lens is in contact with the corneal endothelium. We see that it is decentered toward the supranasal quadrant, and with a reverse Sinskey hook, we can easily reposition it so that it is centered with the previous graft. This lens has a diameter of 6.5 millimeters. Once it is placed and centered, we are going to place a transfixing fixation suture, entering through the limbus. We enter the anterior chamber and guide the tip of the needle to pierce the plastic lens, bringing it out through the corneal epithelium. We try not to manipulate too much to avoid displacing the graft. We check with the OCT that it maintains its position, and we observe that it is perfectly adhered. Now we are going to remove the safety suture that we had placed. To avoid passing the entire merceline thread through, what we are going to do is cut both ends of the thread, which we had not tied to the lens, so that the removal is easier. Once these two ends are cut, with the forceps we are going to pull while holding the plastic lens with the capsulorhexis hook. We see that it comes out easily, and once we have centered it, we have placed the suture at the incisions, and we see here the F that indicates correct orientation and the sutures we have placed to maintain the chamber's watertightness. We check again with the intraoperative OCT the excellent position of the plastic lens with the air bubble.